Hello and welcome again. So I made a first video talking about healthcare vocabulary, and we addressed a few professions, like doctor, physician, pharmacist, nurse, and so many others. But I was not able to finish that video, and this time I'm going to be finishing it and also adding extra medical vocabulary for you to use in your daily life or experiences. Thank you very much for watching, and let's dive right in. This is part 2. Jobs and professions in English, descriptions, examples, pronunciations, and extra medical vocabulary. So we stopped at number 10, so we're going to be continuing from number 11, which is going to be a gynecologist. A gynecologist. This is how you pronounce the word. Please pay attention to my mouth movements like this. Gynecologist. Gynecologist like this, okay? So then, what is a gynecologist? A gynecologist is a doctor who focuses on the health of the female reproductive system. They provide care for women's reproductive health, including routine exams, screenings, and treatments. Okay? So what is an example you could use the word gynecologist in? It would be the gynecologist confirmed that she was 7 months pregnant and expecting a baby. I'm sorry if my voice maybe isn't loud enough or I'm speaking different. I'm recording this at night and I cannot really bother the people in the house. I cannot disturb them, so I'm really sorry for that, but the video had to be recorded. So let's go straight to number 12. We have a cardiologist. This is how you pronounce the word. A cardiologist. Cardiologist, okay? So a cardiologist is a doctor or a physician specializing in diagnosing and treating heart and cardiovascular issues. Cardiologists may perform tests like EKGs and echocardiograms to provide guidance on heart health. We're going to learn what an EKG is at the end of the video. So an example you could use the word cardiologist in would be the cardiologist measured my blood pressure. The cardiologist measured my blood pressure. Okay? So 13, we're going to be having a psychiatrist. Pronunciation, psychiatrist. That's how you pronounce that word. So what exactly is a psychiatrist? A psychiatrist is a medical doctor who specializes in mental health, okay? Psychiatrists, they diagnose and treat illnesses or diseases, often using therapy, medication, or a combination of both, okay? They work with the mind. Okay, so let's go to the example you could use the word psychiatrist with. That would be mental therapists are generally not allowed to prescribe medication to patients, but psychiatrists are. Mental therapists are generally not allowed to prescribe medication but to patients, but psychiatrists are. Okay, so please practice the pronunciation, repeating and repeating and repeating how you're going to be pronouncing this over and over again. Okay, so let's go to 14. Again, if you haven't seen part 1 of this video, you can I'm going to leave a link in the description so you can go watch it first and then come back to this video so we can complement it. But either direction or part you watch first doesn't really matter. It's all gonna work fine in the end. So number 14, we have a neurologist. Pronunciation is neurologist like this. So a neurologist is a doctor who specializes in the nervous system and its disorders. Neurologists diagnose and treat conditions like epilepsy, Parkinson's disease, and multiple sclerosis. Sorry, these are diseases that aren't really relevant here. But what you should know is that a neurologist usually works with your nervous system, which is something that links your brain with your body and your maybe coordination, you know, and stuff like that. Okay, so the example you could be using here is going to be the African neurologist recommended traditional treatment for Harry's epilepsy. The African neurologist recommended traditional treatment for Harry's epilepsy. Okay, so that is how you pronounce this one, neurologist. Don't forget it. Let's go straight to number 15. Again, it is very important that you have a pen and paper so you can write these down, and you can also just right away you can pronounce these words just in your manner, you know, like you write the word exactly how it is supposed to be written in English, but then you kind of put in between brackets how you are able to pronounce it, or how you can remember to pronounce the word, just in case you forget. Either way, you can always come back to the video and just rewatch it, and that's gonna help you remember. But please practice repetition. Again, repetition is key. If you don't repeat, you're not gonna learn. If you repeat, you're gonna be the best. So keep doing that. Okay, number 15. We have anesthesiologist. Anesthesiologist. That's how you pronounce the word. So they are a doctor responsible for administering anesthesia before surgery or a medical procedure. Anesthesiologists monitor patients' vital signs during procedures to ensure their safety and comfort. Okay, so I'm pretty sure if you have gone through surgery or know somebody who has gone through a surgery, that there's always a doctor that's gonna inject you with some sort of drug or medication that's gonna reduce or stop completely the level of pain. You're not gonna feel any pain, or you're gonna feel less pain when they cut your skin, when they do surgery on your body. Okay, so the example you're gonna be using here is going to be the anesthesiologist increased the dose of anesthesia. The anesthesiologist increased the dose of anesthesia. Okay, so those are the 15 jobs. I only had 5 here. The rest, the 10 first jobs and professions, are in the part 1, in the video part 1. So now we're just gonna go straight into the extra medical vocabulary. Here we're not gonna be having any examples. I encourage you to make examples for yourself. If you want to, you can write the examples in the comment section. So please do that, and I promise to read and like them. Okay. The first word we're going to be having here is appointment. You pronounce it like this: appointment. Appointment. Okay, so an appointment is an arrangement to meet a doctor at a particular time and place. Okay, so we scheduled an appointment to scan my brain, to scan my legs and see if there's any issue, any problem with it. Okay, so we have a doctor's appointment. That's how you use that word. So we have here the second one, diagnosis. Diagnosis. A diagnosis, it's like figuring out or discovering what is wrong. Okay, so imagine your body's like a puzzle, right? And you're not feeling well. Doctors, you know, the physicians, they work like detectives, you know, to find out what exactly is going on or why you're not feeling well. They ask you questions, they run some tests, and they look at the clues to find the problem. This is called a diagnosis. It's like saying, oh, look, you have a cold. That is the diagnosis. And then we have, after diagnosis, we have we're going to be having a prognosis. Now, Prognosis is, it's like a weather forecast for your health. It's the future of your health. After the doctors figure out or discover what is wrong, they find out or they give you the diagnosis. They look at all of the information that they have to try and guess or figure out what's going to happen next. They might say, oh, don't worry, you will be back to playing soon. That is the prognosis. You'll be fine in 2 weeks. That's the prognosis. Okay, so that's their weather forecast for your health. Let's just put it like that. So it might take a while to feel better. This is the prognosis, which helps guess how things will go in the future based on what they know about your health condition at the moment. The next word we're going to be having here, I'm sorry, I think I just have something on my ears. I'm sorry about that. And I'm also sorry about the lighting. I'm recording this at night, and I hope it doesn't look too bad. So the one we have here is prescription. Prescription, like this. Prescription. So a prescription is like a special note from a doctor that tells you what kind of medicine you need to feel better or to take when you're not feeling well. It's a bit like a recipe for medicine. The doctor writes down the name of the medicine, how much you should take and how often you should take the medicine, So you take this note to a pharmacy or a drugstore, and you're gonna find a pharmacy, a pharmacist there that is going to give you the medicine and kind of orient you even more on how you should take it and how often you are going to be taking the medicine to feel better. So the other word I have here is to commit. In the medical term, commit is the legal process by which a person is confined in a psychiatric hospital because of a treatable mental disorder, usually against his or her wishes. When somebody's usually forced to go to a psychiatric facility to be committed there because they are mentally unstable and they can be treated, they're going to be taken there even if they don't want to go. Okay, so they can be fixed or taken care of, right? So you could say Sarah has been committed to a New York psychiatric hospital facility or something like that. Okay, so let's just go to the next one, which is to be sick. To be sick is to be afflicted with poor health, a disease, or an illness. To be sick. To be sick. Okay, so anesthesia is our next word, and you guys already know how to pronounce this, but if you don't, it's anesthesia. Anesthesia, which is going to be insensitivity to pain induced by the administration or the injection of drugs before a surgical procedure, So that's to stop you from feeling pain. The next one we have here is injury or a wound. So I'm gonna just explain this in the simplest manner possible, because you don't really need that advanced stuff right now. But it's when the skin or other body tissue, breaks or it's lacerated, open, cut, something like that. You're gonna have an injury or a wound. So you could say I'm injured, or you could say I'm wounded. That basically means the same thing. So the next word we have stems from the same root, which is lacerated. Lacerated. So a laceration is usually a cut or a wound in the skin. Sometimes they can be deep, like very deep cuts, like you say, oh, I'm lacerated, So that's usually what a laceration is. Next one is to bleed out. To bleed out is to die from the loss of blood. To bleed out, you are dying because you are losing so much blood and there's not much blood to keep you alive in your body. So you just die. The next one we're going to be having is bandage. Bandage, it's a strip of woven material, woven material that is used to bind up a wound or to protect an injured part of the body. Let's say you lacerated, you injured, or you wounded your fingers or your arm or your hand, so they're gonna bandage it. They're gonna put a bandage over it, okay, so we can stop it from bleeding or from getting an infection and helping the healing process, So let's just have the next one, which is going to be side effects. Side effects, okay, pronunciation is side effects. I hope the light isn't stopping you from seeing my mouth movements right here, but it's side effects, okay? Side effects, also known as adverse reactions, are unwanted, undesirable effects that are related to a drug or a medicine. Let's just say you're having a headache and you take Tylenol, which is supposed to help you feel better and take the pain away, but instead of doing that, it increases the pain and it gives you pain in other body areas, or maybe you get diarrhea. just saying. So that's a side effect or an adverse reaction. Next expression we have is inpatient care or outpatient care. And inpatient is, do not confuse this with impatient, which is the lack of patience somebody might have. But this one is an inpatient. An inpatient patient or hospital patient is somebody who stays in the hospital to be taken care of, So an outpatient patient is somebody who receives care from the hospital, but then they can go home, So if you stay in the hospital for like 1, 2, 3, 4 days, you're an inpatient at the hospital. But if you go there, you get treated and you go home at the same day, let's just say, or on the same day, you are an outpatient. Okay, so you don't really need to stay there. Let's go to the next one, which is to be discharged. To be discharged. A hospital will discharge you when you no longer need to receive inpatient care and can go home. Let's say you're in inpatient care, you got malaria and you have to stay in the hospital. So when you're finally cured, or as close to cured as you can get, before the doctors can allow you to go home, they can discharge you. They will discharge you so you can go home and get treatment there, or just be fine because the disease or illness is gone. The other thing we have, I think, this list is not that long. Let's just get it over with. An X-ray. An X-ray is to look at the bones or joints, It's an exam to scan your bones and joints and to detect problems with soft tissue or your internal organs. They're gonna scan you and they're gonna see how your internal organs are working, or your bones. If you have a broken bone, they can detect that with an X-ray. Okay, an X-ray machine. Next, we're going to be having an MRI, which is a type of diagnostic test that can create detailed images of nearly every structure and organ inside the body, So they're usually MRI machines that they put people there so they can scan to see if there's a problem in the person's body. So that machine will actually make an image of your whole body and then tell the doctors if you need any medical assistance in any area of your body. Okay, so next one, it's an MD, which is a medical doctor. So if you go to a hospital and hear them say, let's just call the MD, you're gonna know that they're calling the medical doctor, or maybe outside, because in the previous video we know that a doctor, a medical doctor is a doctor, but a doctor isn't necessarily a medical doctor, So next we have EMS unit, which is the emergency medical unit, easy to understand. Next one is the ER, which is a very used one, famous one, emergency room. It stands for emergency room. Next one, ICU, which is intensive care unit. Intensive care unit, you know. PCP, primary care physician. Primary care physician, you know, which is the doctor who takes care of you primarily. A PT, which is the last, no, is it the last one? Not really, but we're close. PT, physical therapy. So I'm having my PT sessions on Wednesdays. Having my physical therapy sessions on Wednesdays. The last one is CPR. CPR is actually very, you hear it a lot in movies. It just stands for cardiopulmonary resuscitation. Cardiopulmonary resuscitation. And it's usually when somebody stops breathing or their heart stops beating. So I think they press their hands here and then they do this, they do that, and the person slowly comes back to life and starts breathing and their heart starts beating again. So I really had to record this as fast as I could. It ended up being around 20 minutes or over that. But thank you so much for watching the video. I really cannot stay any longer. Please like, share, and comment. Please tell me what you think about the video. What would you like for me to cover next? And I am glad that you were here with me. See you on the next video. Bye-bye.